and help have less PEM symptoms given the amount of activity. Yeah.
Do you see
if...
any?
Oh, go ahead.
Do you see any improvements with stimulants? There are a lot of anecdotes in the dysautonomia forums. Obviously, they tackle the ANS, and as with everything with ME/CFS, some patients do respond really well and others don't. But is this something that you have seen in your practice at all?
Yeah, one of the drugs that we use in adolescents and young adults, probably the most commonly used class, is the stimulant class. And in part, it's because they act as very good vasoconstrictors. So if the problem when you're upright is that you've got too much blood pooling in your vessels of the lower half of the body, causing them to constrict and push that blood back up to the heart and brain is going to lead to benefit. Not everybody tolerates the stimulants. Some people get too much insomnia or reduction in appetite, or they just feel too agitated. But they can be a very helpful class of medications. The advantage of stimulants over a non-stimulant vasoconstrictor like midodrine, especially if you've got adolescents who are going to school, is that they only need one dose in the morning of a long-acting stimulant, and that lasts them till the late afternoon, whereas midodrine has a very short therapeutic span of just 4 hours. And so when we're starting that on a school child, we need to send in a note to the nurse every couple of days when we adjust the dose. It really is quite cumbersome, and it's tough for people to comply with a regimen that involves 3 or 4 doses of a medication daily. But we find that the stimulants are really often quite helpful, especially I think in the group that has laxity of their connective tissues and joint hypermobility, because if their ligaments are loose and their skin is stretchy, the wall of their blood vessel is likely to be stretchier when they've got that column of blood going down by gravitational pooling. And so if you can counteract that with a stimulant or midodrine, you're usually going to do better. I think one of the misconceptions about stimulants is that they create some kind of false energy and then lead to worse PEM. We just don't see that. We find that if the person's energy is better, it's because they're getting more blood flow to the brain. Yeah, so I would not worry too much about that. I think as energy improves with a given medication, you got to be careful that you're not doubling and tripling the amount of activity that you have in a day. You have to still work up gradually, or else that will create some PEM. I don't know if you have any further thoughts on that, Doctor.
I have seen a few patients at times with kind of not false energy, but mainly like cognitive exertion. Like I've had a few patients that take stimulants or higher dose stimulants, and all of a sudden they, run themselves into PEM because of activity. I don't think it's like the most common thing as people think. Like it's not as common as perhaps the perception is, but I've seen it happen in some of my patients, mostly with cognitive exertion, which sometimes they have to be more vigilant about. But yeah, I mean, I used to be kind of more hesitant too, but since I've been working with Dr. Rowe, I've been kind of utilizing them more because I can tell that there's an improvement, beyond the brain fog with the orthostatic issues, and certainly are well tolerated, and usually you don't need high doses. Yeah.